Madam Speaker, our constituents are looking for us to put aside partisan politics. They want us not to play political games, and they want us to find common ground to address the unprecedented, deadly challenges caused by COVID-19. We need to work together to lower prescription drug prices. We need to work together to aid states in stabilizing health markets damaged by the ACA. We need to work together to lower out-of-pocket costs for patients, including capping seniors' drug costs under Medicare, encourage participation in private health insurance, and we really need to fund our community health centers. We need to increase the options available through the market and end surprise medical billing. We could do all that. We could do it together, and it could become law. Unfortunately, instead, here we are, wasting time on a partisan bill that has zero chance of becoming law. This is no way to govern at any time, but especially in a pandemic. At a time when we're asking our nation's innovators to find new cures and treatments to address COVID-19 at record speed and with record investment, Democrats want to enact a socialist drug pricing scheme that could devastate this country's innovation in the middle of a global pandemic. Frankly, it's unconscionable. This legislation before us today provides $100 billion in bailouts for insurance companies at a time when insurers are not paying for elective procedures due to COVID. Now, we all want to make premiums more affordable, but all signs indicate insurers do not need a bailout right now. Wouldn't that money be better spent, Madam Speaker, on funding our nation's community health centers, giving them certainty rather than letting their funding run out in just a matter of months? They're on the front lines of this fight in our communities. They're on the front lines of the fight on testing and treating patients in rural and underserved communities. Shouldn't we fund them, give them stability and certainty? And speaking of money poorly spent, today Democrats are proposing we spend $400 million to prop up Obamacare's enrollment. This includes $100 million for the failed and discredited Navigators program, $100 million for outreach and marketing only for ACA-compliant plans, not any of the more affordable alternatives, and $200 million for states to boost enrollment, and no strings attached, no transparency, no accountability. This law has been on the books for 10 years, and we must spend nearly $500 million to make it look like it's working. In this bill, Democrats want to force states to expand Medicaid, allowing expansion states to get 100% of federal Medicaid payments, while punishing, in the middle of a pandemic, taking money away from non-expansion states, taking it away from their Medicaid. That's what this bill does. If they don't expand, federal government's heavy hand comes in and takes money back out of Medicaid. It's vindictive and it's probably unconstitutional. You know, the Supreme Court, Madam Speaker, said expansion is the state's decisions. This legislation violates that. We need to work together with the states as partners, not treat them like subordinates. Now, in the last Congress, I advocated for multiple policies that would help states stabilize health markets damaged by the ACA. But unfortunately, House Democrats repeatedly blocked our ideas. We all want patients to have access to high quality and affordable health coverage, but this measure doubles down on policies that have already failed. One thing is clear, we need to make our health care system work better for all Americans. That's why our goal should be to advance solutions to protect patients, to stabilize healthcare markets, to encourage greater flexibility for states, and to promote policies to help Americans get and keep coverage. Madam Speaker, I have great respect for the chairman. We've worked together on a number of different issues in the Congress with great success at the Energy and Commerce Committee. Unfortunately, our bipartisan work to lower drug prices was derailed by the Speaker in December when she decided to force politics over real progress. You know, I recently read an article about a man suffering from ALS who has dedicated his life to finding a cure. And like Americans with ALS, there are millions of Americans suffering from other life-threatening or debilitating diseases. And like cancer or sickle cell anemia, they are hoping, and their families are hoping, that one day there will be a cure. Now, it's not debatable the bill before us today will reduce the number of new treatments in the future, new medicines, new life-saving medicines, perhaps. Council of Economic Advisors found there could be more than 100 fewer treatments, fewer medicines that would just never be invented, never be discovered if this legislation we're going to vote on becomes law. 100 fewer. We can lower drug prices while preserving the hope those praying for a cure have. There is common ground to be had here, and I've offered many times to work on bipartisan legislation that would lower drug costs without limiting, perhaps even ending innovation. H.R. 19 is a bill comprised entirely of bipartisan policies. That's our Republican alternative, but it's not just a Republican alternative. Everything in there is bipartisan. And already 7 of the provisions we put in months ago have been signed into law, proving that it is indeed a bipartisan package. And instead of pursuing proven bipartisan solutions, unfortunately, Democrats again are forcing partisan politics on this House and this country, fewer options for patients at a time when we need more treatments and more cures than most. This bill is a perfect illustration of why Americans are so cynical about Washington. The American people deserve better. Madam Speaker, I urge a no vote, and I reserve the balance of my time.